Influenza virus by Martin Kastman. What is influenza? Influenza is a common virus known as the flu. There are several types of influenza, including A, B, C, and D, but the one that I'm focusing on is influenza B because it mostly infects humans. Taxonomy. Influenza B is a virus. His kingdom is Orthornavirate. Its genus is Beta influenza virus, and its species is Beta influenza virus influenzae. Influenza B virus has a simple structure with a spherical shape, an outer lipid envelope covered in spikes, among other features. Influenza B lives primarily in the respiratory tracts that includes nose, throat, lungs of infected humans and animals. First, the virus enters throughout breathing. After that, the virus sticks to cell surfaces and it proceeds by sneaking inside them. Then the virus spreads to nearby cells and forces them to replicate. Influenza B virus was isolated and identified by Thomas Francis Jr. in 1936. Influenza spreads throughout cough, through talking, and also throughout sneezing. Another way to get infected is by touching contaminated surfaces and then taking your hand to your nose, mouth, or eye. The symptoms that influenza B includes are fever, chills, cough, sore throat, runny or stuffy nose, body aches, muscle pain, headaches, fatigue, weakness, and sweats. Every year, influenza A and B together cause about 290,000 to 650,000 deaths worldwide. Most of the cases happen in Africa, South America, and South Asia due to high population densities and constant virus circulation in tropical zones. Some ways to prevent influenza B is to get your annual flu shot, having constant hygiene like frequent hand washing, covering your coughs and your sneezes with elbow or your tissues. Oseltamivir, known as Tamiflu, and the flu vaccine both protect against different types of influenza. The flu vaccine is only approved for people aged 6 months and above. The annual flu vaccine was created in the late 1930s and early 1940s by Thomas Francis Jr. and Jonas Salk. Oseltamivir works by blocking the enzyme neuraminidase, stopping the flu virus from cutting sialic acids and spreading. The flu vaccine introduces harmless viral pieces, training your immune system to fight possible future infection. Oseltamivir is effective in treating influenza by making shorter the duration of symptoms, and it reduces the risk of complications like lower respiratory tract infections and hospitalization by 52%. The annual flu vaccine is moderately effective, typically preventing 40 to 60% of flu cases. Getting vaccinated for influenza B creates significant social benefits by boosting community immunity, protecting vulnerable groups that includes elderly, young children from severe deaths and illnesses. The price of Tamiflu ranges from $25 to over $100 for a 10 capsule pack. Annual flu vaccine costs with insurance over $100. The first 3 days are the peak of sudden symptoms. This includes fever, aches, cough, and fatigue. And later in the first 7 days, the immune system starts clearing the virus. Antivirals like Tamiflu and oseltamivir significantly help if started early within 48 hours, reducing severity and duration of the virus. Using science to treat influenza has big benefits. Antiviral medicines can reduce how severe the symptoms are, shorten how long you're sick, and help prevent serious complications like pneumonia. The people who can't get the treatment are those with low or even no insurance because of its price. Kids need to be 2 weeks or older. Influenza B often causes seasonal outbreaks, especially in schools, affecting children and young adults. It has also caused larger outbreaks in history, like the major US epidemic in 1985 to 1986. Patient profile. Name Felipe Drillinson. Age 11 to 19. Location urban. Income level high income. Living conditions dirt floor. Risk factors chronic illness. If Felipe gets infected, influenza could infect his nose, throat, and lungs, causing fever and inflammation. Common symptoms include fever, cough, a runny or stuffy nose, sore throat, headache, body aches, tiredness, and low appetite. Even though he has good access to doctors and medicine due to his high income, he's still at risk because of his chronic illness, which makes flu go harder on his body. And a dirt floor, which can irritate his lungs. He could feel sick for a few days, and he may need medicine, rest, and fluids. Complications like pneumonia could happen, but they are less likely since he can get medical care quickly due to his high income and location. Overall, with good care, Felipe would probably recover safely, even though the flu would make him feel bad for a while. These are my sources. These are my image sources. Thanks for your attention!